Well, as a nurse, especially when people are in the hospital, and many times we get them when they're extremely ill, and they're really not in a good position to recall information. They're, either in pain or have some other symptoms, or they're exhausted and, they're overly stressed and they can't necessarily retain the information. So having something tangible to hand out that can, let them have a touchstone for, okay, this is what's going on, is so essential.
The patient that sticks out in my mind the most is a patient that came in through the emergency department. She wasn't taking her meds because it was such a new diagnosis. She didn't understand the disease process and why it was so important for her to take those medications. Giving her the patient instructions, I was able to explain to her the seriousness of the disease process, and then she understood she really needed to take her medications.
When you're in the hospital and you have so many different things going on, the patient is left with, what do I do? Do I know anything? How do I even ask the questions that will let me figure out what's important for me?
The nurse is left with, how do I translate this into the future for them? How do I help that patient help themselves to maintain their health or to improve their health?
And so really the education is so important in that instance to prepare the patient to know what to expect and to give them an understanding of why we need to do it and to help them cope with that.
Nursing is always time-driven. And if you've got a choice between giving a med, doing a dressing, or teaching, the teaching will always fall by. So you can integrate it as you're taking care of the patient. Sometimes when you're physically touching the patient or at the bedside and you've got something and I say, hey, you know what, when I'm doing this, I'm going to listen to your chest. You read this piece right now and tell me if you have any questions.
It is so important to have information that you can give to the patient, something to take home that they can say, okay, that's right, this is what they said.